10 to 25% of all pregnancies actually end in miscarriage. So I'm not surprised that you're here Googling, YouTubing, could I be having a miscarriage? I myself experienced a miscarriage, and it was devastating, and from that point on, every little cramp and bodily fluid that I felt or experienced, I was worried, I was anxious, and so I was doing the same thing that you are. So I want to go through some of the most common signs of miscarriage and hopefully make you feel a little more at ease or help you to know when you should contact your provider if you are concerned. So if you're experiencing one or more of these symptoms, that is a good reason to contact your provider and say, I have some concerns. One of the first signs is any white or pink mucousy discharge that you're experiencing, or if you're having a bright red bleeding or brown spotting. The trouble with this sign is that it could be a sign of miscarriage, but 50% of the time, the pregnancy goes on to be a successful pregnancy. So I'm hoping if that's the sign you're experiencing, that that's the case for you, because there's a 50-50 chance that it could be concerning or it might not be concerning at all. But if you are experiencing it, it's definitely a good reason to contact your provider. Another thing that could be a sign of miscarriage is if you are having any change in your pregnancy symptoms. So let's say you were experiencing nausea or you had sore breasts and now you're not experiencing those things anymore. That could be an early sign of miscarriage. I do want you to keep in mind that at the 12 to 14 week mark, a lot of times those pregnancy symptoms disappear, which is a really good thing if one of those symptoms was morning sickness, so that you can go on to be able to eat and have a healthy pregnancy. However, if it's before that point, if you haven't been to hear the baby's heartbeat or get an ultrasound recently, it might be a little bit concerning. And the same goes for weight loss. If you were starting to gain weight pretty steadily and now you have stopped or you're experiencing a weight loss, this would also be another good reason to contact your provider and let them know that you have some concerns about your pregnancy. Some of the other first signs of miscarriage are cramping. So if you are experiencing cramps in your back or soreness in your back, don't think like muscle soreness, because maybe you just were on your feet too long or you did a new exercise or you gardened all day yesterday. That's like a muscle soreness, and that shouldn't be too concerning, hopefully. But if this is more like a menstrual back pain, cramping, this would be a good reason to contact your provider. The other type of cramping is when you have like a cramping of your uterus, as you would with your menstrual cycle, especially if it's like every 5 to 20 minutes. This could actually be contractions. Obviously, it is way too early for your body to be having contractions if the baby is healthy. So this is your body trying to get rid of the baby if it's no longer living. So that cramping, and especially if you are experiencing any type of discharge or bleeding with clotting, sometimes this can be a sign that your body is starting to get rid of the tissue and the baby. And as hard as that is to hear and to think about, it is definitely a reason to be concerned and contact your provider right away. And the last sign of a miscarriage that I want to talk about today really kind of pisses me off, actually, and you probably can tell by my tone this is near and dear to my heart because this is what happened to me, but no signs at all. Sometimes miscarriage is not identified until there's no heartbeat found with Doppler or ultrasound or through blood work. For me, we had a very normal pregnancy. I might have had a little bit of spotting, but I contacted my provider. We did an ultrasound at 7 weeks. Everything was fine. I felt like I could be confident going forward. But when we showed up at our 12-week appointment, she went to do the Doppler to hear the heartbeat, and she didn't hear anything, which does happen, so not always a problem. But then we went to do the ultrasound and we saw the baby, but there was no movement and no heartbeat at that point. And along with being sad and devastated, I was so angry. I just felt like my body had really betrayed me. Like the baby wasn't even living, things weren't going right, and my uterus didn't even know what to do about it. And that was really maddening for me. I kind of felt broken, and I felt like my body's not normal. My body is just, it's betraying me really. And so as I worked through that grieving process, I learned that this is something that does happen to women, and it's really hard because we are nervous enough about pregnancy, and you try to get pregnant for so long sometimes, and then you have to worry about miscarriage, and it's really hard, and I completely understand why you have a lot of anxiety. And this is why I don't think we should ever feel bad about contacting our provider. And a good provider is going to understand why we're nervous, why we're anxious, and help us to be reassured with things like blood work and ultrasounds and using Doppler to hear our babies. So I do want to let you know that after that first miscarriage, we did go on to have 2 healthy babies born. And as hard as it was to work through that first grieving process, eventually we did get to a point to have that successful pregnancy. So I hope that this is a message that is just, you don't even need, because it's not a miscarriage at all. But if it is, I want to let you know that there are others that have been there. We understand your pain. There is reason to grieve, and we really hope that if you do decide to try again, that you have a successful pregnancy. And if that is the case for you, this channel is full of tons of things that could help you during your pregnancy, and I'm all about helping moms have a great pregnancy experience. So come on back when you are ready for that, and we would love to journey with you during your pregnancy.